stresses for doctors and other healthcare workers around finances?
She got the job and she was so excited and so happy because her approach to the interview was within a framework. You can do it without anyone knowing. And if you became pregnant in your training, you had to leave.
Hello, everyone, and welcome to another episode of Passive Income Doctor. Today, we have a special guest, Gail Carmody. She has many degrees, including RN, MBA, and a Masters of Management, and now works as a coach for healthcare workers. Welcome, Gail, to the show.
Thank you. Thank you, Daniel, for inviting me on. I'm very excited to be here.
So let's start. What is your background and what do you do now, kind of day to day?
Okay, well, my background, as you've given a little bit of an introduction there, I started life as a registered nurse, but quickly moved up into management. I had an idea right from the beginning that I wanted to go into management, management of hospitals. So I quickly moved up to director of nursing positions and then moved into CEO roles, but mostly in the private sector. So I've had a lot of experience in the private sector. And then I moved into business development from CEO. And that was a new initiative, really, for private hospitals. They hadn't done that before. So it was interesting because it was something that you didn't really focus on, was developing the business so openly. And that became something that we did. It was very exciting because I always had an orientation towards business, always enjoyed business. And so it was a great role. And I liked it particularly because it was almost, because it was a new role, it was me using all my initiative in finding new business, remaining ethical, of course, um, and developing the whole service from the concept of the service to how it was to be structured and resourced within the hospital, and then sourcing the doctors to support it as well. Um, so that was a great thing. And I think that's what led me into the medical consulting that I did afterwards. And that was across Asia and the Middle East. And I did some in New Zealand as well. But it was very exciting across Asia and the Middle East. It's a different way of doing medicine. It's all very good. It's very exciting because they're really willing to take on new ideas as well, and they're willing to learn from the West as well. So that was very exciting. But I realised as I was preparing for this podcast tonight that I'd actually been involved in two startup businesses in Asia. And if anyone knows what business is like in Asia, particularly the first business was in Indonesia, and that's highly political. So surmounting all the political barriers was a minefield. But when I look back now, it was very exciting actually, and very rewarding to actually get the businesses up and running. So in general, my comment about health is there's plenty of opportunity for business and remaining ethical and providing a good service. So that's a little bit on my background. And what I do now is, well, I actually meant to retire, but then I didn't. I mean, what's retirement anyway? And I went into coaching because all the years I've been working with doctors, I've seen their issues and their problems, and healthcare workers um, around personal life, professional life, careers, finances, and all those areas. So I decided to become a coach um, and start working with healthcare professionals, doctors and healthcare professionals. And I work across many areas with them, as I said, professional, personal, career, direction, financial, setting up businesses as well. Um, and yeah, so that's what I've gone into now. Um, So that's been, the other thing I do is work with doctors, particularly around exams.
Hmm.
I'm contracted to a college at the moment that I work with the registrars around exams and preparing them for exams. So that's what I'm up to now. And from day to day, my life's changed from when I was in corporate and corporate health completely. Before it was all hustle, bustle, rush, 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 16-hour days.
Wow.
A lot of networking events as well that required a lot of hours, socializing, which was sort of that PR work behind the business development and setting up businesses. Um, and so I don't do that so much now. Now I've taken a completely different look on life, which I think we all should learn from. And now I spend a lot of time in the day. When I wake up in the morning, I don't jump out of bed. I set an intention for the day. And I always have a little routine of doing some exercise, doing meditation, doing gratitudes, and doing some reading on personal development. So that's how I start my day.
Yeah, setting up your day for success. Yeah, very good.
That's it, exactly. Because what we tend to do is we tend to jump out of bed and we just run on this autopilot and we go into the same routine and rush around and we let the day take control of us, not us take control of the day. So that's one thing that I teach everyone really is to start taking control of your own day. And it can be done. It's just we need to be aware of it. So that's how I start my day before I do any business activities. So, and the exercise can be, anything from walking to Pilates to whatever people enjoy doing. It doesn't have to be onerous. It can just be, for 30 minutes a few times a week. But it's really important that we do it just for general health anyway.
Yeah. And I think healthcare workers often, will give advice to patients, but ourselves, might be time poor or, working shift work. It can be hard to have that routine, but I think it's still a good reminder to try and form some good habits around our health as well.
Very, very important. And that's why we also experience high levels of burnout because we don't focus on ourselves. That's across all healthcare workers. We always think the job's more important, the patient's more important, our career's more important. But without our health, we actually can't service those things anyway. So it requires a little bit of discipline of setting that time aside and making it a habit and making it a routine. It's really easy to let it slip because you're tired, you've done shift work, you've done long, maybe night shifts, and it's easy to let it go. But what you find yourself doing instead is either sitting staring at the TV or scrolling
Mm.
on the Facebook or whatever social media you use. It's just dead time. So you're not actually relaxing and you're not getting any benefit whatsoever from those activities. So taking some control of how you manage the start of your day and the spare time that you have, I think is really important.
Yeah. And what about for, say, doctors or nurses who do shift work? Any kind of tips or things you've seen people implement well in terms of having a routine around, as you said, mindfulness or exercise?
Those that really, are on top of the burnout and do set boundaries, do have a routine. Okay. And it takes, some people say 21 and some people say 30 days to develop a good habit. So if you stick to it for that amount of days, start with 21 and really be self-disciplined in doing just one activity. Don't make it 10 things that you have to do because you'll never stick to it. So it can be anything. It could be going for a 15-minute walk. It could be meditating for 10 minutes. It could be reading for 10 minutes, something beneficial. So just something small and do it for 21 days. And you'll find that you'll start and then add to that maybe for over the next 21 days.
Mm.
Start
Yeah.
small. Because start big, it all falls over.
Yeah.
Mm.
And I guess finance is often a taboo topic amongst doctors, but I guess you're well placed in terms of your work with doctors and also, as you said, working, I think you said business development roles and also working in the private sector. I guess obviously some people might be the opinion that, healthcare should be a human right or, should be free for everyone. But I guess the reality is a lot of things, are needs but cost money, such as food, shelter, things like that. For yourself, I guess, what was kind of some common themes or stresses for doctors and other healthcare workers around finances?
It was really, as you said, it's a taboo subject and always has been. And I think it's fabulous that someone like yourself is now talking about it. It's really, really great. We all need money to live. We all have to exist and pay bills, etc. But what I found was because particularly new doctors coming out and finishing, because it was a subject not spoken about, they were really lost as to how to start, where to go. Like, do I go into general practice? How do I actually bill?
Mm,
How do I get my money? Um, and then if it was a specialist, they had to then find their way into specialist rooms to be accepted into the public system and whatever. And then how did they negotiate? What were they worth? What did they ask for? What was the normal way of approaching that? So, like, to get to the end of your training after all those years at medical school, um, and then actually not know any of those things is quite a sad situation, and it's a bad reflection on us as a society. It should be part of the education of everyone, really, finances, but particularly doctors, because they're going into a private business. They're either going into a practice, they've got to earn money somewhere. So even if they're working in the public system, they still, there's very few full-time staff specialists anymore. There used to be.
mm.
So they have to then still earn money somewhere and run a private practice or be a part of a private practice somewhere. So, and that's a business. So doctors should really, I feel, as part of their general education, have some business modules in their education. So they've got some idea about finances and about starting business and what their worth is and how they set up, etc. And I think that's what drives that lack of education as a part of the routine their education, then makes it a continued taboo subject throughout their whole training because it's never spoken about anywhere. So it's something that then they feel they shouldn't speak about. So I think that really needs changing. Because
Yeah.
I
I
think
know for myself, yeah, during medical school and then through junior years, doctors in training years, for myself in general practice training, yeah, it's not really talked about. You kind of left to learn on yourself or from online or from talking to some colleagues, but then obviously some colleagues might not be as comfortable discussing these things. And yeah, it can be very difficult, I guess in general practice, yeah, in Australia, overwhelming majority of GPs are private business, whether as a contractor in a clinic or as a GP clinic owner themselves. I think there's a perception in the public that GPs are kind of government employees, which is not the case. And obviously very topical, coming up to election is about, kind of paying for GPs and, private gaps. But unfortunately, the reality is, the Medicare rebate hasn't kept up with healthcare inflation. And I was listening to another podcast where healthcare inflation is much higher than CPI or general inflation. And yeah, there have been some GP clinics that have unfortunately gone under. And basically, to have a health service, you need the health service to remain solvent. You need a GP clinic, for example, to remain profitable so that they can provide the service. It'd be a great shame if there was a loss of service. And I guess for specialists as well, I've heard anecdotally, and some specialists, they go through, 5 to 8 years to get their medical degree, depending whether undergraduate or postgraduate, and then go through their, couple of years as a junior doctor, and then enter training program, which could be, general practice a little bit shorter, but some programs, neurosurgery, I believe, 6 years. So by the time you become a consultant, you're in your like early to mid 30s. Um, and if you're only trying to scramble and learn about money and try and find out how to get jobs at private hospitals and how to get GP referrals, can be quite challenging.
Mm, very much so. And people tend to forget that doctors don't finish their training until they're well towards 30, mid 30, or sometimes even late 30s. So that's a lot of years to go without an income. Um, I don't think that the majority of people realise that. And as I mentioned before in earlier discussions, a plumber can leave school at 17 and by the time he's 21, he's getting 250,000 a year. And nobody quibbles about that. The plumber comes in, they might whinge a bit, but they pay him. They're happy to pay for the service. So there's a lot of years doctors go without an income. So that means that their income years are very short, very, very short.
Hmm.
So, but it's not that they earn millions once they finish their training anyway. And particularly GPs who are always fighting to have some recognition for their worth and be paid what they should be paid. And as you mentioned, a lot of people think that it's a human right to have health services, which it is, and we do have a public system, so that is available. A lot of countries don't have a public system. So we do that human right is serviced well and truly here in Australia. We have a big public system. But there's also a private system is required to take the burden
Hmm.
from public system. And there's many people in the position to pay for private health or pay for private services. So they are in the position to do so. So I feel it's fair that there's people pay for a private service. And they want it because it's quicker, it's faster, they can ask for who they want to see, they can have choices. So if that's to be provided, then it has to be paid for in some fashion. And as I was saying, I'd worked overseas in Asia and Middle East. If you want good service, people actually go out of the country for it, not just up the road or another town or, from a rural area. They actually leave the country for that service. So it's all about mindset too. So the norm in many countries is that you pay fully for every service that you have.
Hmm.
And so people accept that and are willing to do that. But I think in the Western countries, particularly England and New Zealand, they're probably even worse than Australia, with the mentality of everything has to be free.
Hmm.
And England and New Zealand have very minimal private services. And so that just becomes part of the norm for people to think that way, is that they should be provided for by the public system. But nobody stops to think about how does that get funded? Like the money has to actually come from somewhere. It doesn't just come out of thin air. So, and then they never think it should come out of their pocket. So that's the interesting part. But yes, I really feel that doctors should be a lot more, well, militant's probably a little bit of a harsh word, but maybe self-advocates for, education and knowledge about finances, um, and being the forerunners for the next generations of doctors coming up. Instead of it being a continuum and, the people under you coming up remain in the situation that your, year and years of GPs and doctors have been through, and set the example of starting now to ask questions and talk about it and be open about it.
Yeah. And it is interesting, obviously a lot of doctors come from UK to Australia, but, I think the NHS, I've had a few doctors on this podcast that have worked in the NHS, and I think it's a different mentality there. It's kind of like, can't say anything bad about our beloved NHS. Although, there have been cracks and continue to be cracks, with junior doctors striking, with lack of access to doctors. And yeah, I understand the private sector is very, very minuscule in the
Mm,
UK compared to, say, Australia, or America.
mm,
And but then the problem is, the public system gets overwhelmed, and people waiting weeks and weeks for a doctor's appointment or to get a scan, things like that.
Mm.
whilst some of the feedback is in Australia, you know, relatively quicker to get, say, blood tests done or get scans done. And because GPs are private business and have kind of can practice obviously in a with guidelines, but can have more say over the way they practice versus I hear in the NHS, if you're kind of employed by them, have to follow very strictly their flow charts and guidelines and things like that.
Yeah, that's true. And then look at even broader into America. I mean, I hadn't thought about America. You've just raised it. America's supposedly a wonderful country, and yet look at their health system. They offer a very poor public health system, and mostly it runs under insurance schemes for private health, and that's very, 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 very expensive. And it's not supported at all by PBS or any of those things like we are here. So, overall, Australia does have an excellent service. But I think that the Australian population could learn a little bit from the rest of the world and not expect to have everything absolutely free.
Mm,
And to appreciate the doctors that are delivering the services. And as we said, they worked hard. You don't get your degree or you don't finish until you're 30 or in your mid-30s. And that earning capacity is so short, the period of time so short for the doctors to earn money. And I think as well, if people expect it for free, it lowers their respect for your professionalism. So, there's that saying where there's skin in the game if you have to pay. People have a
mm,
bit more respect.
yeah.
So
Um, and I guess you've worked in a few in Asia. Like which countries did you work in Asia?
Indonesia, Singapore, Malaysia,
Yeah.
and
How did you find kind of um, healthcare system in those countries and also doctors as well? Is it kind of, similar stresses for doctors around the world, or were there kind of some local nuances?
um, a lot of very similar stresses, um, all very hardworking, um, and very low self-care wherever they are around the world. Though I think just in general, the lifestyle throughout Asia and the Middle East is a bit more family orientated and a bit more social for doctors rather than here in Australia where we tend to work, 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 and there's so much expected of you. So I think that general cultural environment makes it just slightly easier for them. Um, yeah, but I think in personality wise, they're very similar. It's a funny thing that you could pick what specialty they were in whatever country you went to, and I'm not quite sure why that is, but um, no, but they you know work hard. Um, they all want to provide a good service. Though the system's different, obviously people have to pay. But they're also very interested in continuing their education and their
Mm,
skills. So all that's very similar across the globe.
yeah. And I think going back a bit about, well, yeah, touch on, sometimes there might be expectation of free service. I mean, free service is still funded by the government, which is funded by taxpayers, right? So I guess all the taxpayers are funding of it. And, a lot of countries around the world have, big budget deficits and, you know, it is a difficult position for governments as well, and I guess having a healthy private sector, um, and obviously having a safety net for the very, very vulnerable, but then at the same time, having a private sector that flourishes and where, yeah, patients have choice and, yeah, people that have more money, they do want to invest in their health. And, having a private sex system, I think, assists in that regards. Um,
It does. And that was a good point you made where you have a safety net for the vulnerable, which we do have in Australia. We have that. So, I think we have a reasonable balance. The private sector is about 30% of a health provision. And even within the public hospital, they are actually a big competitor to the private system because they also get paid for private patients.
Oh,
So if you go in as a private patient, that's a question you're asked, are you in a health fund? And they can take up to 30% of private patients as well. So they have a bulk amount of it and they can take revenue from that. So that's just an interesting fact in here in
yeah.
Australia.
And whereabouts in the Middle East did you work?
Dubai, Abu Dhabi, yeah.
Yeah, UAE. And I guess what's the healthcare system like over there? I heard anecdotally that um, for a period of time, maybe they still do that. They're kind of, offering very high salaries to, I think, doctors from America, UK, etc., and kind of drawing in talent that way.
Well, they have to because their own population actually doesn't work because they're all royal family.
Well,
So their own population doesn't actually work, or very few of them work. I think that might slightly be changing. So to actually resource, they have huge institutions and facilities. And the thing about the Middle East, and they've got the finances, obviously, but as soon as they decide to build, say, a new 20-story cancer centre, it's built within a really short time and completed, and services are up and running. Everything happens very, very quickly, but they do need to source resources from the rest of the world because they don't have their internal resources.
yeah.
So it's not as though there's uh, anything unethical about that. It's just that they don't actually have people working. That's why I have big populations of the Filipinos and Indians as well for domestic duties and all that, because nobody actually has paid work that are residents.
Interesting. Yeah. Interesting country. I haven't visited, but yeah.
It's a completely different way of living to what we are used to.
Yeah. Okay. I guess shifting gears a bit and maybe you can share as little as much as you want in terms of finances for yourself, I guess. You know, growing up, what was money discussions like around the dinner table growing up? Were there any discussions and
It was always considered that that was private business. Um, the only thing that was really encouraged was that we would have enough education to go into a sustainable job that would allow us to have a reasonable life and buy a home. And it was expected we would buy a home.
Hmm,
Um, and even though my parents ran small businesses, they still didn't talk about money. That was a bit rude and, you didn't really talk about those things. So, yeah, that wasn't discussed, which I think should be more open because that's where the education comes from,
hmm,
this generation. But I did, as soon as I started my training and had a regular income, we trained in a different way when I trained than you do today. And within the first year and a half, I put a deposit on a home because I was just driven that way. And that was one thing I'd learned from my parents, that as soon as you have an income, start focusing on a home. So that's what I did.
yeah.
So
Did you
then,
buy a home to live in or as an
yeah,
investment as a first?
well, investment wasn't the big thing then
Yep.
because it was the home, family home. So I actually worked two jobs, even when I was training and studying, and paid that off really quickly. And then I focused on investment
Yep.
properties.
Yep. Very good. Yeah, and it is interesting how the mindset has changed a bit. And I mean, some people also argue, um, like house price ratios to income have become higher. So a lot of people, including myself, when bought first property, it was actually investment rather than own home to live in. Um, I guess also on a side tangent then, just briefly, how is nursing the training different back in the day compared to now?
So, um, we were hands-on. We were actually the human resource. So um, we learnt very quickly, very steep learning curve. You didn't have, there's by the time you were in your third year of your training, you were almost equal to about a year 10 RN now because you
Mm.
had to take so much responsibility. And there were very few RNs because, number one, once you were finished your training, you couldn't, and if you're married, you couldn't sustain the shift work. There was no change in shift work. Shift work was just shift work. There was no variations in hours or whatever. And if you became pregnant in your training, you had to leave. So that was different. But there was a lot of pressure on us to do tasks that today probably wouldn't meet policy from practically just sort of 3 months into our starting our training because of the environment, because there was just no other senior staff. And we had a lot of major cases, and we just had to learn. So, and we had to live on site. We had to actually
Wow.
live at the hospital. So there was no telling any lies about sick days because you couldn't get away with any of that. If you were ringing in sick, you had to go to emergency. There was no,
Wow.
so you couldn't tell any fibs about it. And actually, I trained at St Vincent, so it was run by the nuns, so
Yes.
that made it even stricter. And we had a nun that ran the nurses' home. So she just knew everything that happened, and we could never get away with anything.
Yeah, so it sounds like yeah, it was more hands-on training rather than saying going to uni and having a HEC debt nowadays. Yeah, that is interesting. And I
Well,
guess yeah, yeah.
we got paid wages, minimal wages.
Okay.
Um, so that made a difference. It made
Do you
life.
remember how much was
I
you got
think
paid as a first year
I think I remember one of my first pays was $147.
for a fortnight?
Yeah, for a fortnight. Yeah,
Yeah, yeah.
$7.
Was there a penalty rates? Was there overtime payments? No.
It's got $147 because you're a student,
Ah, okay. Yep.
classified as a student, so you just got that rate.
Yeah.
No, there wasn't any of the penalty rates or anything like that.
Yeah. And and so you did your 3 year training at St Vincent, and then you became kind of a qualified nurse. And then I guess, what was your next step in your career? And I know you had a lot of ambitions. And I guess for our listeners, either nursing or medical that want to, say, enter executive role, managerial role, I think it would shed some light on your own journey.
Mm. So it's what you desire. I mean, I had a desire to move up for some reason. It was just something I wanted to do. And so I took opportunities and I took risks. Okay, so a lot of roles that I actually went for, I probably wasn't super qualified for, but I went for them anyway. And I did get a number of them, and I just learned as I went. So I think good advice is to actually take the risk. Don't wait until you think you've got all the boxes ticked and you're all safe. Actually go for the roles. And if you're not quite eligible, take the second role below it and try and get that experience so that you're eligible to go for that next step. Um, I think it just varies a little bit in the private sector because there's possibly, at the time I was there was a lot of growth. So there was a lot of opportunities.
Mm,
Okay. And if you'd had the experience, you would, have the opportunities very quickly. But I just want to add one comment about the hospital training, and why a lot of people in my period of time went to the top very quickly was because of that responsibility we had so young, we had a certain confidence. And we had a certain confidence that we would always achieve and we would always manage and get through. So I think that was part of the reason as well. I always had confidence in going for the next step and taking the risk as well. So that was just an interesting little point. It was that development of the confidence in your abilities.
mm,
So yeah, I think it's just focus on what you want, look around for where there might be opportunities, and actually take the risk and go for it.
mm. That's really great advice. I think a lot of people feel yeah, imposter syndrome, or, I'm not quite, ready for that. I haven't got everything figured out. That job ad doesn't 100%, don't tick off every box, but I think that's a good point. And also as well, I guess if you are invited to an interview, that's practice as well. I know for myself, I haven't gone through interviews for a long time and probably a little bit rusty, but I think, kind of practice and speaking and being able to share and explain your work experience is very important.
That's a really good point. It's great to have that experience. And I'll also add there that it's really good to have some coaching before you have the interview. It just gives you the edge on going into the interviews, and going through a certain format as to how you answer the questions. And so it puts your mind around that process of thinking about a succinct answer.
Yeah.
So yeah, having coaching for interviews is a really good thing.
Yeah. And can you give us, I guess, a case study or story, maybe someone you've helped through interview coach. I believe you do some interview coaching. Is that correct?
Yeah,
Yeah.
yeah.
Yeah. Can you give us, it can be de-identified,
Yeah,
obviously.
I'll make
Uh,
up a different hospital and a different situation.
yeah.
Um, so there's two senior RNs that in senior positions in uh, public hospitals,
Hmm.
and they went for the next two levels up. And when they came, one that came to me said, "Oh, I'm really good, and I never seem to get the job, and I've been for so many interviews, and I really want this job." I only had to have two sessions with her and just put her thought processes in the right way. And because she only had 2 days, actually, she was going for the interview. And she got the job, and she was so excited and so happy because her approach to the interview was within a framework. So she was much more confident in giving her delivery. And another RN I worked with who just thought it was imposter syndrome. She just wasn't good enough. She just didn't have the degrees. That took a bit longer, but she got this senior role that she really, really wanted, because she'd been through the interview training, basically.
Mm. And without spilling your, industry secrets, was there that first RN, was there any particular thing that was holding her back and maybe she was doing a little bit wrong where she was, as you said, not getting the roles after sitting so many interviews, and kind of what shifted, or, what did she implement and change the outcome?
Giving examples
Okay.
and giving them succinctly. Okay, that was the only thing she was not doing correctly. So I got her to do that for me, role play, and gave her a framework for doing it, and she did it really well. So, a lot of people, you ask for an example on something, say,
Leadership, maybe. Example of leadership.
and she, I got her to tell me why she'd failed that very thing in a previous example interview. And what she'd said was, and she hadn't realised the way she said it, and I told the nursing staff,
Mm.
you see, and she hadn't listened to herself. So I replayed that to her, and she suddenly saw it, you know, there was a better way to articulate.
Yes.
I worked with the team, we worked together and did X, Y, Z, rather than I told. So it's just simply a lot of the terminology and a lot of the wording that we use.
Yeah. And I think giving examples is very important. I'm thinking back to maybe applications for even non-medicine roles that I had during uni days, working side jobs, and then also afterwards entering specialty training, GP training. Yeah, kind of answering the question, but then also backing up with the example is a good tip for our listeners out there.
Mm.
Um, okay, um, so you worked your way up to management, kind of running hospitals across Australia. I think you had some experience in New Zealand as well. Is that
I
correct?
did a lot of business development there and
Ah,
brought
okay.
cases from New Zealand to Australia because their public health system was failing. So
Oh,
public patients to the private sector.
oh
Yeah.
wow. Oh, so patients would fly from New Zealand to Australia to get some care in the private sector. Wow. Okay.
So that was contracts with the government. But all that was like thinking of those ideas. I'd get some concept that something was happening and then I'd chase it and make it
Mm,
into a. That was what I was saying about, looking at a service, developing the service, resourcing it, and then sort of setting it up. So that was part of business development.
yeah. And if you're happy to share, I think some of the companies you work for or developed, was it HOCA and is that
HCOA, and that was there's been many iterations. That was one of the original. Then it became Main Nicholas, then it became another organisation, and then it was sold off to Ramsay's.
Ramsay? Yep, Ramsay Healthcare. A lot of Australian doctors would recognize that one.
Yeah, yeah, yeah. So they were very small actually, and they then acquired beds and developed into quite a robust private system.
Yeah.
Yeah,
And also PPL Holdings, I believe that was in
Indonesia.
Southeast Indonesia. Yeah. And I think there was a program, Skinnyworld or something like that. Yeah. Can you tell our listeners
Uh,
about that?
yeah, so that was actually a colleague of mine. She'd already gone before me and set up an allied health clinic. There are so many political stories behind getting it set up. Anyone that's had any experience in Indonesia. Um, and so I went to join her, and Skinnyworld was actually one of the offerings, and it was a weight loss program. And the purpose of that was because around sort of 2000 on, a lot of the wealthier Indonesians had gone into the Western countries and brought back Western food.
Mm.
So all the locals were acquiring a taste for Western food. So obesity was just burgeoning and is still.
And this
Um,
was in the 2000s, was it?
yeah, up
Yep.
to 2010,
Yep.
2015.
Yeah.
So hence I initiated a weight loss program, but then I franchised it. So
Mm.
uh, it was successful, but I'm not part of it now. But that's sort of another initiative. But this is just example of how doctors can actually think, how they can start programs, how they not to be embarrassed about building businesses and about thinking about money. Um, I actually did it for the excitement and the challenge, really.
Yeah.
But it just shows you what you can do in health.
Yeah.
So you think beyond what you're currently doing.
Mm. And it is inspiring. I think there's a lot of doctors I can see on LinkedIn and some of the other social media that are branching out and doing other things. Could be, AI, technology, yeah, weight loss management. I interviewed Dr. Angela Kwong on my podcast recently as well. And yeah, I think it's very inspiring for myself as well to kind of think bigger picture and to see, what can do. I guess for that Skinny World weight loss program, what were, besides the political ones, I guess, what were some of the challenges and what were some of the strategies you do? Because I know, talking to a lot of entrepreneurs, building a business where it involves, lots of staff and infrastructure and payroll and, can be very challenging. How did you kind of like, did you have any kind of plan initially and maybe had to pivot? Like, how did you grow that business?
So with the infrastructure, it's just the usual business running. So if you're not familiar with how a business runs, that's where some of the education needs to come in, with that back of house stuff, with even the systems you need to put in place, what resources, human resources and skills you need to employ for the purpose of the business. So if you're not aware of any of those things, you need to really become educated with that before you even think about setting up a business, really. So I was familiar with all those things, but setting it up in another country is a little bit different. But the fortunate thing is that a lot of people speak English in throughout Asia, especially professional people or people with skills that can run offices, etc. So it was a matter of there's a lot of networking occurs in Asia more than here. So that's what made it easier to set up a business there. And that's what made it much easier for marketing as well. And people are very social and they like going to social events. Um, so that made it actually easier in Asia than it is here.
And so was that kind of those social events or word of mouth, how you recruited staff? Is it, I assume, doctors, maybe dietitians or personal trainers or like, yeah, how did you kind of grow the team?
Someone always knows someone, so you interview them. And that's how I grew the team there. But there were international people came from uh, Scotland, England, and Ireland as well, and Germany. There's a big relationship with Germany and no, Holland and Indonesia. Um, so there were a lot of people come from there that were skilled, like podiatrists and physios,
Mm,
etc. And so there were avenues for advertising in those countries, and they would come and give the professional support.
yeah.
So we used local doctors, but we had to go through programs with them as to what we and how we wanted it delivered. Um,
Yeah, how
but
did you get the local doctors on board? Because obviously usually doctors are very conservative and like how did you kind of get them on board, I guess?
well, we went for the younger ones. So, and for people that wanted some flexibility, particularly new mums, because they wanted some flexibility in their working hours. Um, so that's who we targeted in our advertisements.
Yeah.
And that made it easy to fill. And it was good because having young people, they're enthusiastic, they've got open to new ideas, they're willing to learn. So it made it a really good team.
Yeah. And how did you did you found it all 100% yourself or did you have co-founders or
But we
funding from places and yeah, how did you kind of start it from that side of things?
started it from our own money, but it is good if you can find funding if you're first starting up. But then you have to watch how you manage that as well. That can be, and where you get the funding from. In Australia, it's a different story. You have your secure banks and whatever
Yes.
loan places, so that's different. But if you're starting to vary that in Asia, um, that's a whole podcast on its own, actually.
Okay. So yeah, I guess you don't have
So
to
we
reveal
have
too
to
much,
bring it
but
back here
yeah.
to Australia because most people
Yeah.
would be looking at building a business here.
Oh,
So
yep. Yep.
that have secure,
Yeah.
loaning facilities here.
Yeah, but I guess a lot of business owners do start with their own money, kind of, back yourself, skin in the game. And yeah, I guess if you're a very, very early startup, even banks in Australia probably wouldn't be very keen to lend to you. Yeah, so good on you for kind of starting that, yeah, all by yourself and in a different country as well.
Well, I had my
That's,
colleague as
oh,
well.
okay, okay, co-founder, yeah. What was that? Was your co-founder like a local person in Indonesia
She
or?
was Australian,
Oh wow. Okay. Yeah.
and she'd run podiatry practices here.
Yes.
And so she had that allied health knowledge as
Yes.
well.
Yep. Yeah.
Yeah.
Perfect. All right. So I guess kind of heading towards the end, and I guess, some of the themes I think I've picked up from our chat today is kind of importance of self-development, importance of knowing your worth, importance of confidence. Do you have any kind of frameworks or tips for how healthcare workers can develop these things?
There's an interesting fact about confidence. We're all born with it. We're actually all born with confidence. That's why when you're learning to walk, you fall over and you get straight up, you don't go, oh, I fell over, I'm not doing that again.
Mm,
We're all born with it. But by the time we're 5 to 10 years of age, 85% of us have lost a certain amount of our confidence. And unfortunately, it comes from simple things. It can be something really small that's said to you as a child. And it often comes from our family, our friend, our social groups, our grandparents, a religious leader, or someone like that.
Mm,
But the good thing is it can be redeveloped and rebuilt. And so, what I always say is if you're not feeling confident, the other side of confidence is fear. And so, always ask yourself, why am I fearful? And what can I change about this?
mm. What am I fearful
Is,
of?
is this fear actually true? And how can I change it? So, the interesting question is always, how can I change it in any negative situation you come across? Because we actually have the ability to change. So, yeah. So why am I fearful? Why am I not confident? And how can I change this?
Yeah. So I guess, can you give a case study or example of how this might apply to, say, a doctor? You know, it could be a junior doctor trying to get into a competitive training program, or it could be, yeah, a specialist trying to get, a staff specialist or VMO job in a hospital.
Um, I think it's always having someone to talk to as well, but someone that isn't going to support what your fears are.
Mm,
Um, so it's having a person that's already been there, done that, that has some really good advice is a good place to start. And if you don't know of anyone like that, seeking some professional coach in the area is a good place to start as well. There's many doctors don't have confidence when they're first going out, and it's such a shame because they're so well qualified, and there's no reason why they shouldn't have the confidence. The other interesting thing about, you mentioned a couple of times, imposter syndrome. Imposter syndrome is actually lack of confidence. So it's the same thing. So
mm,
whenever you're feeling that way, another time, say, why am I feeling this way? How can I change? What's the first step I can take to change this? All right. Because we all actually have the ability within ourselves. It's just recognizing it and putting it into play.
mm. That's a good one. What can I change? Instead of saying, oh, I'll never be qualified, it could be, what course can I do? What reading can I do on this topic? Podcasts,
Yeah.
and anyone in the area could reach out. And even if you're rejected, can, as you said, dust yourself up and ask a few different people. And yeah, I think somewhere else I heard is a lot of successful people, they are usually quite willing to share and help other people up, rather than seeing everything as a competition, collaboration and yeah.
Competition's a killer. As soon as you're comparing, you've destroyed yourself. So always stop comparing. You're unique. Everyone's unique. And it's like you and I comparing each other, it's apples and oranges. It's the same if you're comparing yourself with whoever you think's more successful than you. So comparison's a killer. So it's a habit that people should really avoid.
Mm,
But talking to people, having the confidence to talk to people, and as you said, people that are successful are happy to share and they're happy to help others on their way. So don't keep yourself, try and ask for help, talk to others who have good advice. And the thing is, it's not only just reading and self-educating, which is something you need to do, but it's just literally changing your mindset and saying, yes, I can. I can do this. I can do this. I've done that so many times throughout my career where I've got to a point where I've thought, I don't even know what I'm going to do here. I don't know what the answer is. And then I've turned it and said, I've sat with myself and said, I've got the answer. I've got the answer. I've got the answer. It's literally what I've done. And something's come up.
well,
So I've done that many times. And the answer does come.
mm,
There's a saying, we actually have all the answers within us. And I hadn't realised the meaning of that until I'd sat at one stage and thought about how many times I'd asked for the answer when I didn't know what the answer would be.
yeah.
So,
And in terms of tips for, say, doctors that are going through high stakes exams or interviews, I guess we did touch on interviews before. Um, do you have any kind of tips for, yeah, for example, I think you do some you're a coach for, I think, the Akram College of GPs as well. From your experience in that, like any kind of tips for GPs that are kind of struggling or feeling lack of confidence in passing exams, or whether written or kind of verbal OSCE style.
Number one, plan. I find so many people, doctors don't plan. So they do it all ad hoc. So I'll study this tonight, I'll study that. Oh, I've got to do this, so I won't study. No definite planning. Number one, plan. Biggest thing, biggest tip. And plan, re-engineer, come backwards from the date of your exam to now, and do a detailed plan. Okay, really, really important. The second point is know why, know your why. What's your driver? Why do you really want this? Why do you want to do this exam? Why do you want to get this degree or whatever it is? Know what your values are. A lot of people don't know what their values are. And set boundaries. Really set boundaries, personal boundaries. Healthcare professionals in general are so great at saying yes to everything because they think they have to say yes. Start setting boundaries on your time, on
Mm,
your sleep, and your emotional and self. I think they're the biggest things. And breath work. I can't express that enough. Breath work around is so good for anxiety. It's good for everyday professional life anyway. And I always teach the box breathing, which is 4 times 4 times 4, because breathing can be done discreetly and nobody knows you're doing it. And in the middle of an exam, you can do it, even if it's a interview style exam and nobody knows you're doing it. So it's four, breathing in through the nose to the count of 4, hold to the count of 4, and then breathe out through the mouth to the count of 4. And what it does is it actually converts you from the sympathetic into the parasympathetic. So you go from that flight and fright
mm,
is, and you come into the rest and digest state. It literally transitions you into that. So anything with breathing, there's all forms of it, but I always suggest that one because it's you can do it without anyone knowing, and you can
mm,
do it anywhere, anytime. Or another one is if you're feeling nervous and anxious and worried. This is not just in exams, but anytime with it could be a difficult patient or VMO or someone having a hard time. You can just count backwards from 5 to 0. And it also converts you from that sympathetic to the parasympathetic state. So they're just a couple of small tips. I always say keep it simple. Don't make things complicated. We love making things complicated. Just keep it simple. Bring it down to the simple things. So number one, planning. Know your why. Know your values. Set your boundaries and breath work.
mm. Yeah, thank you for sharing that. I think that's very helpful and something for doctors, yeah, all stages of training, and even outside of
Mm.
doctors, just, in everyday life as well.
Now you get
Um,
caught in traffic and you're getting angry because you're late. Do your breathing. Doesn't matter anymore.
um, so I think thank you so much again for coming on to the show, and we've covered a lot of things talking about, different healthcare systems around the world, which I think a lot of our listeners will find helpful. Sharing your kind of, yeah, entrepreneurial journey, and healthcare and business, you know, isn't exclusive to each other, and in some ways it's very important for healthcare workers, clinicians to be involved in business. Business is just a way of kind of delivering service and delivering value, to the world. Um, and also, thank you so much for talking about some of the tips for, yeah, high stakes exams, high stakes interviews, and and kind of setting boundaries, and which, yeah, I know a lot of GPs that I talk to, and even myself, sometimes it is hard to kind of, set boundaries, and with our time, and with billing, can you answer this email or do this script without a consult, and expect to do it for free. And it's just, saying yes to one thing becomes more things. And I think valuing your worth is something that I think is difficult for GPs, but hopefully, I think things are changing, especially with some of the younger GPs as well. With these topics, and was there anything else you would like to share with our audience in closing thoughts today?
I just really want young GPs to start, becoming more vigilant about their life, their business, all aspects of life, and not you know, to end this taboo about finances. It's something that's an open discussion. Money's just energy, just passes from one person to the other. Everyone has to live their life. We all have to pay bills. And you're professional people that have worked so hard to get where you are. And I think you should be demanding your worth, is my advice to all doctors really, but especially the new ones coming up.
Yeah. And even kind of even me hearing that internally, I go, that is so true, but I guess it's something in the back of your head kind of saying, hey, you're a healthcare worker, you're meant to, it's a calling, it's kind of, self-sacrifice, and, you're meant to, not care about money is what I've been, also had some of the comments on some of my social media, but it is a difficult area and controversial in some ways, but then in other ways as well, yeah, work very hard, and also, hopefully in society, if you want your best and brightest, smart people to enter medicine, then, it still has to, be kind of remunerated well, otherwise everyone going to, I don't know, investment banking or something, I guess.
It has to start somewhere, and it has to start with someone. Someone has to go before in whatever change there is made. And you're brave enough to be one of those.
Yeah, thank you for that. And yeah, with this podcast, I guess, yeah, one thing is, yeah, try and break down the taboo about money. And also as well, I kind of started it because I saw a lot of my colleagues kind of, not sure where to go to, not sure who to talk to. So yeah, if you're a kind of listener, healthcare worker, someone in your life that you feel will benefit from this episode and this podcast, yeah, please take a moment to, share it with them, and um, subscribe, and open up some dialogue around finances. And I want more doctors and healthcare workers to take an interest in their finances. It is good to have team of, accountants, mortgage brokers, buyers agents, etc. around you, but you yourself still need to take responsibility and accountability, and you're like the leader, the captain, if you like.
Mm. Very true. Very wise words.
Yeah.
Yeah.
So finally, Gail, thank you so much for coming onto the show. How can people, reach out to you, connect if they want to find more about your coaching?
Yeah, that's easy enough. I'm on Facebook. They can just go get me by email, actually, gail@coachingforhealthcare.com. Um, I'm happy to talk to anyone, just to have a chat and see where they're at and help where I can. Um, I give a lot of free services too, but I'm at the stage of life where I can. And I'm one of those that loves to help people, grow and progress. So, but just email gail@coachingforhealthcare.com is a great way to contact me.
Yeah. Thank you again for coming on to the show. I think a lot of listeners will have great value from this one. And to our listeners, again, thank you so much for tuning in. New episode every fortnight. Share this with someone in your circle of influence so that we can kind of break this taboo, and yeah, kind of start a movement, if you like. Until next time.